everyone heard the recording start, I'm going to go ahead, excuse me, share my screen, and we're going to talk through that PowerPoint presentation kind of like we did on Monday, just to go over a high-level overview of what we're going to be covering today. And again, I have to read the disclaimer, even though we're not using a true database, so there is no protected health information going to be shared. Content recorded with point-click care is valid only as the date the recording is made. Information or instructions about any given topic may subsequently change. Content may include protected health information. All content is to be treated as private and confidential. Recordings are managed by the requester, and point-click care recommends that files be stored in a secure location with controlled access. Okay, everyone? So today we're going to break the CRM, which is your customer relationship management module, down into 3 sections. First area we're going to talk about is configuration, how you want to customize this to best fit your terms, your needs. Now, the one thing you want to remember is CRM, the customer relationship management, is run at the management console level. So the terms that we select are going to follow through all the locations. So we want to make sure everybody's comfortable with the terms that are being utilized. Then, once we get through some configuration items, again, depending upon your security, like we talked about during the first training session, some of you may be able to do configuration, some of you may not. Once we get through config, we're going to talk about lead entry. And again, how I get my referral into the system, follow all my activities, enter as much data as I can, because I want to put as much information into CRM. So when I do win that referral, and I'm going to teach you how to do what's called a possible placement and wait list. When we admit the resident through the quick ADT link, all that good information that we've put in, demographic data, contact information, even if I upload a document, if I complete an assessment up there, it's going to follow that resident down into your main database. We're not going to have to duplicate our effort. So when you see the lead entry, we're going to put in as much information as possible, because not only is it relative to the resident that we're doing, but the activities I do to try to win this referral. And I want to put in as much effort, and I want to track that so everybody knows what I'm doing. My dashboards that we're going to see later in the third session are going to display information, as well as reports that I'm able to print and others are able to generate, are going to show all that good information as well. So the more data I put in on the front end, the better data I'm going to get on that third section you see here on this screen, called the monitoring the pre-admission process. Some things are organizational driven, and we'll get into a deep dive concept about which are driven the dashboard. And then each user would have the ability to do custom reports. So you'll see that as we go through the third part of the CRM training session. What is driven across the entire organization? What can each user do a custom setting for them? Because maybe they want to look at things on a different level, different time period. So some are driven across the organization, some are only user driven. So the first part of what we're going to cover is going to be a lot into the CRM administrator role. As we talked about during managing security, you had the CRM administrator role, the sales manager, and the sales representative. So the administrator, and if you have the management console access that we talked about previously, they are going to be able to go in and do a lot of this pick list configuration, because that's going to be driving across the entire organization. So that's why I said we want to make sure we have an internal meeting, talk about the verbiage we're going to use, make sure that we have it nice and set so everybody's using the same terminology. The user preference, that's going to be for an individual user, and each person is going to want to go in and do two things possibly. Definitely you're going to set your time zone. The second one is kind of optional, depending on how you want to see the first lead list when we get there. We'll talk about an activity calendar integration. I will turn it on in my training database because all it does is create an icon for any user. Not anybody has to use it, but you can integrate the CRM activity calendar to your Outlook or Google or any email system that you use if your company allows for that. But all it does is show you the steps. It does not integrate automatically. It just makes an icon available, and I'm going to show you that a little bit later. I'll talk about predefined activities. If you are an organization that has skilled nursing, assisted living, independent, you can set predefined activities up if you'd like to. And that will state, when we'll talk about it, oh, I do this first, a day or two later, I do this next, and I do it, religiously, basically. I do the same process. If that works for you, you can set them up as predefined. I talk to a lot of clients and they're like, Rick, doesn't work that way with us. This referral, I might do an email first and then a phone call. But this referral, I might be, skipping 3 steps ahead. So sometimes a predefined activity really doesn't meet the needs, but it's there if it could. We'll talk about online documentation storage categories. Again, the system comes default with some. If you do have the proper security rights, you will be able to create new. To be very specific, again, this is driven through the organization, so you want to have that good deep talk about setting those up so everyone's using the same thing. But I'm going to show you how you can do that, but also how I can link that and make it available in the CRM module. So that way, if I do happen to upload a document there, it can follow the resident in when I win them. We'll talk about some custom assessments. Again, I'm using a training database, so there's only going to be a couple there. But if the clinical side starts building their own assessments, those can be linked in the CRM too, if there's any type of assessment you might do on a pre-admission process. So I'll show you, again, if you have the proper security rights for that configuration, how you can turn them on and off. CRM configuration. We'll go in and talk about things that I want to make mandatory to cause a little red asterisk to show up on that referral. Again, I want to be cautious because if I don't get that for every referral, may not want to make it mandatory. It'll still display as an entry point. It just wouldn't have to be entered before I could save it. And then we're going to talk about accounts and their contacts. Now, in the customer relationship management module, your CRM, they are known as accounts. In the rest of the database, and I'm going to show you where they are stored, they are called external facilities. Think about them as your referring hospitals. If you get referrals from other nursing facilities, assisted livings, areas like that, we call them external facilities in the main database, but in CRM, they refer to those as an account. And what I want to do between my accounts and their contacts is I want to link them together. And I'm going to show you how to do that at the first part of the process, because if I get a referral from a specific hospital and maybe they have 10 employees, I can link it to the appropriate contact. So when I'm following up on a referral, I know who to contact. So those are going to be some of the major items we look at under configuration. Then we're going to transition in and talk about key terminology as we do that, but also how the key terminology appears when I'm entering my referrals. And then we're going to take a practice resident, and I want you all to do this in your practice databases when you have time, is recording that referral from start to finish, getting them in the first time, walking them through what we call a referral process from being new to contacted. Again, these terminologies can change to what you would like, but I want to show you how that referral process flows so everybody knows where they're at in the middle of that process. And then we're going to move them the whole way through as accepting them. We're going to put them on what's called a possible placement. Very important step is what's called a wait list. By putting them on a wait list, that allows the resident to show up in the database for my admitting staff. Maybe it's late at night and the clinical staff is going to do the quick ADT, quick admission, discharge, or transfer. Or maybe it's during the day and maybe my admission staff member is going to do the quick ADT. But if we don't waitlist them, they don't appear in the database. And we're going to see that through the process today. If they don't appear, somebody might enter them manually. It doesn't recognize them from CRM and it won't pull the data down. So we want to make sure when we win that referral, we do that very particular step process of possible placements and waitlisting. And then the third part of the session after we work on a resident is then I'm going to show you how I can review the information based off of dashboards, reports, how I can customize those. And again, you'll notice that word waitlist showed up here again, making sure that if I got that person into accepted status and I know they're going to come, let me look at that little lead dashboard. Do I see that that person has been waitlisted? If not, let's make sure that we update it so my admitting staff can see them under a waiting list tab in the main database. So those are going to be the items, everybody, that we're going to talk about. As we talked about on the security call, making sure that we grant them the appropriate access of that CRM level, whether it be the administrator, the sales manager, and or the sales representative. Again, administrators can set up the CRM module. So we just want to do some configuration. Then we're going to walk through that whole step process of getting the referral in. I'm actually going to show you a couple screenshots, everybody, because right now your eligibility verification system is not turned on and I can't activate it in my training database. So I have some screenshots of some test residents that's going to show you when eligibility verification is turned on, I can get that response from certain insurances. Not everybody participates like we talked about during managing security, but if they do, I can have the verification run even before they're admitted as my resident. So I can verify if the insurance companies do participate, do they have coverage? Again, each insurance sends over what they want. So it may not be as detailed as their website or a phone call to them, but we're going to at least have some data that they are active, or maybe they have, if it's a Medicare, maybe they have a Medicare Advantage or an MSP. So we're going to see some of that as just some still screenshots, but it's nice to see today, but we're also going to see that again on eligibility verification training a little bit later on our workflow process. And then, like we said, the last part is going to be looking at some of the dashboards. What can be customized for me versus what can be customized for the entire organization on other dashboards. And then reports, those are user driven. If I create a report, that's my report. I see it, but Wanda wouldn't see it. Wanda can create her own report. So we do have functionalities that allow you to customize things for items that you're interested in looking for, but maybe a regional or executive wants to see things a little different. They will have the same capabilities. Okay. So as you all know from the last session, once we get to that getting started, I'm going to stop sharing that screen, everyone. I'm going to share my other screen, and then we are going to be in my training database. So again, when I first log in, it always takes me to my home screen. Again, based off of those security levels that we talked about on the previous call. Up here at the top, under Management Console is where we're going to do the majority of the configuration. But even if the user doesn't have Management Console access, the one thing I want each of you to do that does have access to CRM is hover over CRM and go into what is called User Preferences. When your database is configured, it always defaults to the Eastern time zone. So if you're in Central, different time zone, please make sure that you update that to your appropriate time zone, each of you that have CRM access. And then the second question is going to be, do I want the default lead list to only show the ones assigned to me? Starting off, you may not because till you learn the system, somebody else might be working on a referral and you want to see it. I'm going to teach you how you can customize that filter as well if you decide not to have the default lead list go only to the referrals you're working on. And again, you'll have access to the referrals that are for your location, but if you have locations that are close to one another, they may both see the same referral. And each location, like I always tell the stories, I worked in Pittsburgh. I had 13 buildings that I oversaw in a 30-minute radius of Pittsburgh. So they got the same referrals from the same hospitals. And each admission director was able to document on that referral because, the person, till we know where they live, they might go to this home, they might go to that other home. So multiple communities can be working on a referral. And, if one's not going to bring them in, they can just leave the referral there. The last community that would make the decision about whether they are going to admit or close the lead, they would then do the final step process of doing the possible placement and waitlisting, or if no one is going to bring the resident in, then the last location would physically close the lead. If 3 buildings are working on it and the first building closes the lead, it closes it for everybody. So the last deciding location would make the close official. So that's why a lot of times people always want to see this because maybe I haven't assigned the referral to me, but it's been assigned to another location. I want to see it. Maybe it's one I can work on. So this one is completely up to you, but definitely change your time zone. Next thing I'm going to do is jump up to Management Console. Up here, I'm going to go to CRM and go to Setup. Now, this is what the administrator can do. And again, as we were talking earlier, since you are a large organization, CRM is run at Management Console. You want to kind of get the group together and say, okay, we saw what Rick was talking about. Here's the terminology that we all use. We want to be consistent because this is going to flow across all the organization. Okay, everyone? So the biggest area that you're always going to be coming back to periodically is what is called your first link, called the CRM pick list. The reason is I always kind of explain to everybody, when you first get CRM, think about it almost like a living organism. It's going to continue to grow and become more robust until we finally finish, maybe not all, but the majority of the configuration. Certain sections you may come back to more often than others, and I'll kind of point which ones those could be. But some of them, when you set it up the first time, you may have it set the 100% on some of these access points, but other ones you're going to come back to a little bit until you make it the most robust that it could be. So the first thing we're going to look at is what is called our source type. Now, what I want you to think about here is when I put the referral in, there's going to be a box that says, how did they hear about you? That's what you want to think about this source type. So the system will come defaulted with flyer, hospital representative, physician, and social media. Resident referral and employee referral was one I added in for training sessions. But each of you may have other reasons why somebody heard about you, right? I actually was working with a client and the person didn't know anything about them. They were just basically walking by and noticed their sign and walked in and asked about admitting their mother. They put that in as how they heard about you. But it can be anything. If I broadcast like social media or radio, TV, a company I worked for did billboards and they also did the videos at a gas station pump. They wanted to track it very specifically. So I can do that. All I have to do, if things I don't use, if we don't send out flyers, I can delete it or edit it and change the name. Again, it's yours. We want you to configure it to your verbiage. But in this case, maybe I'm going to do new and, we're going to do, one of my buildings is doing billboards around their community. So if somebody comes in and says, hey, that's how they heard about me, I want to know that. So when I hit the new button, all I do is type in the entry point and click the check mark. And now it becomes part of a drop-down menu when I'm putting the referral in. Again, this is one that could change periodically, right? Maybe I do some newspaper, art, flyers, advertisements. I can come back here and make that active. So this one, once you get it really set with all the options, you may not touch that one a lot, but always think about that as the how did they hear about me? Lead rating. Again, this is going to be across the organization. It comes defaulted hot, cold, warm. I've had clients change it to basically a 1, 2, 3, but think about it as from your gut feeling. How does that person feel about this? Okay. Are they really amped up to come in? Or kind of like those cold calls. Hey, I'd like to get some pricing about my mom and dad, but I'm kind of thinking about it, but I'm not 100% sure. Okay. Tiffany, as I stated, when the referral is entered in, because it's run at Management Console, you may see it for a little bit, but I'm going to teach you how to filter that list down to show it only you in case it's something that somebody else entered in. And then I want to go ahead and maybe not show that referral because it's not my area and I only want to see the referrals related to my location, right? So you're going to be able to do that a little bit, but because it's run at EMC level, starting off, you will see a lot of the referrals, okay? Because again, only because if there's multiple buildings around the same area, those referrals could be being utilized by many, but I'll show you how you can do a drop-down filter to change that to show just yours. Sorry, I saw a question and answer pop up. Okay. So if you're good with hot, cold, warm, but again, have that talk with everybody. Then we get into activity subtypes. Currently, there are 5 total activities that Point Click Care has: call, task, appointment, email, and tour. Under a phone call, when I put this activity in, I can say specifically, well, it is a phone call, but here's the sub activity I want to call it, right? So I all entered in initial call, but this was one I created. Your system will come with follow-up and scheduled assessment. But if there's any other type of phone call you may do, click new, add it in, maybe request for documentation, right? Again, it can be whatever a phone call sub-activity type you prefer to be able to use as a drop-down menu. Tasks, very generic, kind of has admin and other, but if there's other tasks you may do, you can create those as well. Appointment, kind of a meeting or a phone meeting. If there's other appointments that you would want to activate in here as well, you most certainly can. Email, we have follow-up, information, and or other. If there's other information you might do, I had one state that like they would do an email for send admission paperwork. I had a client that they did that through their system and they wanted to record that. Maybe it's pricing or anything like that. But again, I enter it in, it becomes an available option for anyone to use. Okay. And then Mator will come with just to everybody. It'll come with initial and then revisit. I actually changed this term on my call this morning, but I actually wanted to track, sorry about that, very specifically if a person came a third time as well. So it'll actually only have 2 entries when you did it. I added in the third if you really want to track those visits. Okay. Don't be afraid. Like I said, talk to the group, set it up the way everybody's going to be consistent with it. Lead status reason. This is going to do this one more time, everybody. I call it a happy little glitch. Notice my activity subtype opened back up, but I don't want to see that again at this point. I want to focus in on is lead status reasons. Why am I closing a lead? Am I denying them or am I losing them? So when it comes to denied, we have financial, high risk, and services. But the Pittsburgh area, I had to deny somebody. Technically, it was financial, but we wanted to be a little bit more specific. Ugh, can't type on a Wednesday. Is we were out of network with that person's insurance policy. So I'd have loved to have brought him in. I just would have never got paid. So I can be very specific, out of network, any other reasons that you would deny somebody. You want to be as specific as possible because when I close a lead and I say denied or lost, it's going to ask you for the reason. And these are going to become available of your drop-down menu. And there's reports that are going to be able to track that info for you. And then why would we lose somebody? Now, these are the two that come defaulted with the system. But there are two items that I always tell my clients, just because it happened to me. Hey, I could lose a lead, and there's two things that are kind of out of my control. One, I hope you always answer that for closing a lead and losing them, is you just don't have the room. But I always have everybody put in that the client at the hospital got better, didn't need to come to us, and they went home. Well, yeah, I was working the lead. I lost them, but it was kind of something out of my control. And then the other one that I put in is the client expired or passed away, whichever term you might like, because I've gotten a lot of referrals, started working through them. We follow up and find out that they passed away at the other location, and we got to close the referral. So those are the big two, everybody, that I always say add in, because it's very nice to have those ready at anybody's fingertips inside that drop-down menu. Referral conditions, everyone, is probably the one you're going to come back to the most often to continue to build. The reason is these are basically their diagnosis of what you're receiving. Now, in the main point-click-care database, there are thousands upon thousands. Out here in CRM, it's basically the majority, but it's not going to cover every condition that your resident referral that you're getting might have. So you'll notice they go in alphabetical order. If I continue scrolling down through here, I can get to the bottom. And like I said, it's not as extensive as you would believe because it's not the main database. So this is the one that people are normally coming back in all the time and continuing to make new conditions. So when I get my next referral, I can pick that. Excuse me. But the nice thing about when I enter the referral is if it's not currently part of my pick list, I can do a manual entry in another box, then come back here if I have configuration rights, add it in, or reach out to my configuration specialist and have them add that new condition in so it becomes part of the drop-down menu for the entire organization. Okay, so this is the biggest one that most people are going to come back to and update until they really get it fully loaded with conditions. Okay. Level of care. Now, there may be certain levels of care that you don't offer at your organization. Like The ones we did not offer, and I'm going to activate this real quick so it looks like your normal database, everybody, is the communities and the companies I worked for, we didn't offer what was called rest home care. So, not that they may never do it in the future. So, instead of just deleting it, I have the ability to inactivate it so it's not part of a drop down when I'm tracking my referral information. The other one is this one called memory care. It's going to come over as Alzheimer's, but a lot of people may refer to it as their memory care unit. So I actually went through and just changed the name from Alzheimer's to memory care. But if the Alzheimer's is the level that you treat at, you can leave it that way. But again, I can edit and change names. If I don't do traditional hospice, again, I can delete or inactivate. But again, it's for the entire organization. So again, the terminology, just want to be consistent with. Professional contact types. You heard me talk about earlier in the main database, they're called external facilities, the hospitals, nursing homes, assisted living facilities that I could get referrals from. In CRM, they're referred to as an account. And what I'm going to teach you today is to link the person that works at that hospital to their hospital, or AKA in CRM, the account. When I'm installing them in here, I want to be able to link their appropriate professional contact type. Are they a social worker, a discharge planner, physician? Again, are there other terms that you use in your area? Definitely could be. So again, I can create a new specific position, and that way I can link it to the appropriate contact there. In this case, mine are pretty good. It kind of covers everything that I can think of off the top of my head, unless there's one that you all know that you don't see listed there. Please feel free to type it in chat or just tell me it. But most of these cover the hospitals and nursing facilities that I worked at that we got our referrals from. Possible placement status. This is the second time that little pop-up glitch happens. But notice I closed the one, but I left the second one open. The reason I leave status reason open, that was the first one we talked about, is if I put somebody on a possible placement, and we're going to see that a little later, if I deny them, I want the same reasons listed here to appear down in this section. So when we actually deny somebody, or lose them, I should say, you're going to see why. Because I may not know until we actually put the person on a possible placement that we were out of network with an insurance company. So anything I put here, I want to make sure that we have in the appropriate bottom section matching. Okay. Now, and again, Daryl, this is organizational or company specific. So that's why I keep saying you want to have that meeting to make sure everybody's on the same page with that terminology. Okay. So here, if I flip my lost and then my possible placement lost, notice I have lost to competitor, lost to sister facility. I don't see that up here because remember, if multiple locations are working on that referral, only the last location is going to close that lead. Okay. So that's the reason you don't see it duplicated there. But, if I lost somebody because they went home or expired, again, I may have already been working on them. We accepted them. We talked to the family. They were going to come. And then it happened. And again, I want to be able to remove them from the possible placement and link the appropriate reason why. So I like that when I open this one up, this opens up at the same time because I can easily match the two together. And I want to, and you're going to see when we close one lead why we do this. Now, under competitor, and there is a pre-built report that looks at your competitor, but as Daryl was asking, if I start putting in all of the competitors across the company, yes, each is going to see that because you can't drive it to say, well, UPMC Presby is only available at, these 3 locations. So in the competitor build, you might get a lot more competitors that you might lose somebody to because again, it's driven at the EMC module. But if you're able to obtain where somebody may go rather than your company, I'm able to list that when I close a lead. And there is a pre-built report that is called lost to competitor that will keep track of that. And I can run it for a 30, 60, 90, 365-day period. So competitor that could get quite large with the size of some organizations when you're putting in all the competitors. But the competitors that are in your area. They show up in alphabetical order, so it's kind of easy to find, but it could get extensive with the size of bigger organizations as well. Sales cycle. This is definitely something you all want to agree upon. Now, when this comes in, this is just called qualified, and this is just called presented. When I did the training earlier today, I didn't have time to come back and change these. But think about this as the sales cycle process as your referral moves through. Okay. And, they start off new, and that I can't change because everybody is truly new. Then we contact them, and then you can change really anything that you want to make the verbiage your own. Okay. And there's a question in there. We have multiple facilities within ECO looking at the same admit. If a facility loses the referral, if that facility closes out, can the one that is accepting the resident still see them? Remember, if the first facility decides not to take that resident, they don't close them. The last facility making the determination closes that lead. Okay. I think that was Heather asking that question. Okay. So if you want to change this, and again, I refer to it as a sales cycle, you're going to see a banner bar when we get into our first referral. But think about this company-wide. Okay. If they put them on a possible placement. So some of the questions coming through until we get to that section might want to hold off, but that can happen. Then anybody can close the lead. Okay. So we'll hit that when we get to the referrals, because again, I'm a multi-facility database, so you're going to be able to see exactly the questions that are coming through. I love the questions. We just haven't got to that part of the training. Excuse me. Account cycle. These are your hospitals and external facilities. And I'm from the Pittsburgh area. Locations close, and I can document that to the account. But in your areas, have you ever had a hospital change names? I can link that, and I'm going to show you in the account how I can, what I'm updating here, how I can link that to the account. Okay. So I'm just going to type in that second one. So location closed, or the name has changed on that account. So back under setup, the next thing you have the availability to do are what are called predefined activities. And what that means is I can set up predefined activities for each specific placement. So let's say at a skilled nursing location, I do this 100% of the time. If you don't, this is where most of my clients will tell me, Rick, doesn't really work for us. I could make a phone call, I could send an email. Predefined activities can be set up to say that I'm going to go ahead, make a phone call within 2 days or 1 day, and I'm going to contact the lead and save. Now, once I save this, and I'm going to delete it because in my real life communities, everything was different. But after the phone call, I can say, oh, we're going to send a follow-up email. And we're going to do that 2 days after the phone call. So I can continue this if there is a set step process that you always do. My communities, this isn't real life. So I'm going to delete this, but this will create the predefined activities for you. And then all you do is edit them and keep updating as that referral goes through. But if you have skilled nursing, independent, assisted living, you can set different predefined activities for each location. It's just not something that my organization's used. People are different. If it works for you, please build those. Correct. But the input of some of your admissions and regional staff is kind of important. That's why we review this here. But Heather was asking, this is corporate level? Absolutely. But we want to make sure that everything is correct. Online documentation storage categories. Now, these are in the main database, but I can make them appear and even add them during CRM configuration. The one thing is you'll notice some of these do not have editable links because Point Click Care hard codes those because they're really only clinical style categories. Some are driven to only show up at skilled nursing locations. Some are showed up corporately. But what I want to show you is, hey, if we get some type of documentation, I want to upload that into the CRM referral. So when we're having the meeting, we can look at this documentation together. What I'm looking for is under this column. If this says CRM is a no, it's not going to display there. And I'm going to bring over one of the guides that we use, everybody, just so you can see how easy I can upload information here. But as an organization, this is an area that everybody's going to talk about and say, okay, comes with some default categories. We want to be very specific as to what we put and do we need to create new categories. And by all means, if you have the security access and the organization agrees upon it, and again, I'm just going to call it a test category. Number 2. Now, I have the full ability to say where this category is going to display. Do I want to see it in admin, clinical, what we're talking about today, everybody? And hit save. So now you can see I created a test number 2, and this goes across all the company. Again, that's why you want to have that agreement internally first. But if this is set to a no, it's just not going to appear there. But again, with configuration rights, you can do it. Oops, sorry about that. Getting that little touchy drop down again. Same thing with your assessments. Now, 2 will come by default into your database. There are these pre-admission screenings and a Medicare secondary payer. They don't have to be used, everybody, but they are default set to display in each database that Point Click Care has. I can click on the description, and if this box has a check mark, it means it's going to show up in the CRM customer relationship module. If that check mark is blank, it will not display there. And when we get into a referral today, everybody, because I'm a clinical trainer, we'll kind of look at the Medicare secondary payer, because we do have an electronic version that some of the clients really like. So I'm going to show it to you a little bit, not the whole thing, because it takes a while to update in CRM, in where I can answer those questions. The nice thing is it's linked to the referral. If I do that possible placement and wait list you keep hearing me talk about, it's going to follow the resident down into the main database. So not all assessments may be done pre-admission, but when clinical starts building their own, maybe there are ones that you all use internally that might be nice to link there. That is how I can do it. Excuse me, CRM configuration. This is where I'm going to tell the system what I want mandatory, what can display where. And so like right now says, do I want to make an activity for a new lead mandatory? I tell everybody starting off, you can say no starting off because maybe I don't know if I'm going to make a phone call or an email. But if you know you are going to do something, make it mandatory. What that means is if and when I enter that new referral, I'm going to have to put in the first activity I'm going to do before I can save it. For training purposes, I don't make it mandatory, but you can. It's completely up to you. Putting somebody on an automatic possible placement. I don't do that during training because I want to show everybody the manual process. But if you put them on an automatic possible placement, it will do the first step for you of that automatic placement and wait listing. Today, I'm not going to enable that because I'm going to show you the manual process. This, I always recommend be mandatory. And during our training today, you're going to see why. And then, sorry about that. If I'm going to use document manager in here, which means, are there going to be some pre-admission paperwork that I could possibly have signed electronically and make available in CRM? You can, but the person has to be waitlisted for that to function. So at this point, I'm going to leave this unchecked. We'll talk again about that during document manager training. But if you know you're going to use it, you can make it available. Then comes your lead information. What do I want mandatory? There is only one or two items I say that, when I got a referral, I knew everything that I needed. But the one thing I tell everybody to make mandatory is this status. Because remember we talked about a sales cycle, new, contacted. That's this status here, and you're going to see it when we work on my first referral today. But the other thing I always knew that I got was the primary pay type. Are they coming in Medicare, Medicaid, private pay, managed care? I knew I got that on every residence. I can make that mandatory. If you don't, you can leave it unchecked. These options are still going to be available to be completed. They just won't have a red asterisk and be made mandatory. And then under resident demographics, what do you always get? Now, I always say just be careful, because I work with a lot of people and they're like, hey, we always get the social security number. So they checked it. And later on, guess what? Person says, well, in a larger organization such as yourself, lady says, we don't get it until we accept the person. Well, that accepting may not come till a few days later. So if I make it mandatory, I have to put a fake social security number in. So I always say, be careful. If I don't know everybody gets this, I make as little mandatory as possible. They're still going to be able to enter it, but I don't want them to have to put something fictitious in to be able to save the entry. So these are your options that you can make mandatory or leave an open. I'm just going to leave, again, just those 2 items that I did under here. I know the status because that's what I'm going to pick, and I always know the pay type. If you don't know that one, you can leave it unchecked. Then I hit save. Again, that makes it configured across the organization. The final configuration item is what is called your activity calendar integration. Now, I'm just going to enable it because all it does is create an icon if one person wanted to do this or everybody. It just creates an icon to show you the steps. So I'm going to hit save. Out under this activity calendar, that last link that I just did created that little green icon. When you click on it, all you're going to do is run down through those steps. So technically, you have to do this yourself, but making the integration available just popped up that icon there. That's all that integration making it available does. And then if somebody would like to link this to their Outlook, Google, whatever email system they use, they would just follow through these 6 steps. Now, the only thing it does, it is not bi-directional. What I mean by that, it will put my CRM on my Outlook, but a meeting you put in Outlook will not feed over here. Okay. Okay, Heather, if the mandatory information we chose is not in an electronic referral, what keep the company facility receiving the referral? The referrals, as far as I know, you're manually entering. If you make a field mandatory, you can't save it until you put something fictitious in it. And then come back, and when you obtain the correct information, then fix what you put in that you made mandatory because you didn't have it at the time. So if you make something mandatory, you got to put something fake in it until, or you can't save the entry. That's where I always say be careful with mandatory information. Okay. Thanks, Heather. You got it. And you'll see it here. And that's why I say caution is best when it comes to those mandatory fields, everybody. Okay. So we're going to start getting in there. Again, that setup, like I said, some of it one and done, a little bit other things, and we may have to go back there periodically to build it more and more robust, right, everybody? But when I come into CRM, this is my leads, okay? And now somebody had the question, well, am I going to see all the leads? Yes, because again, it's run across Management Console. Now, I can change and build my own custom lead look. So remember the one that said, make it default to show only mine when we were looking at the, sorry about that, everybody. Default lead list filter to assign to me. If I have that preset, I won't see every referral. I'm going to have to change my filter setting to see the referral and then pick up the one that maybe I'm working on. Once it's referred to me, then it would show up under this default setting. But you can go in here and like right now, notice it says open leads in last 30 days system. So what that means is this is our default setting, but I can change filter settings. Some clients tell me, hey, Rick, it takes longer than 30 days at our location on a rare occasion to get a referral. So I can move this back 30 days, 60 days, 6 weeks, ever I want to call it. Now remember, this is your user dashboard. So what you create here is yours, not across the organization. So let's say that I want to change this back to be, maybe I only have a 45 day. That's the longest it takes for me to get a referral. And now I can start looking at some of those other items, right? So like, I can associate it to account names, or remember we were talking about the assigned to here, is now I can build my own custom filter going, wait a minute, because it's run at Management Console, I see a lot of referrals. I only want to see the ones that are assigned to me. So I can create a custom look, custom filter that says, show me 45 days, but I only want to see the ones that are assigned to me. I can still go back, look at the system default to see the new referrals that come in that maybe nobody entered yet. But if you're manually entering them, you're assigning them to yourself immediately because you're going to see that when I enter this in. But I can set my own filter. Everybody notice this Save As button doesn't work until I hit search. Now the Save As button became active. So sorry about that. Again, you wouldn't say assigned to you, everybody, but I can phrase it whatever I want to say. Once I save this, I've now created a drop down. I can always go back to the system. So I can see the ones that, maybe I'm working on, and maybe my coworker or maybe one of my local facilities is working on, but I'm working on them too, but they entered them. However that works with your communities. But then I can say, okay, well, nah, I'm good there. Let me see the 45-day look back. And then it would be only the ones assigned to me because I set the filter to hide the other ones. So you can build any number of these guys, which makes, instead of always refreshing dates, hey, I got my look back set. I'm good to go. And then every time I come in, it always defaults back to the system related 30-day open. The other thing you can do is this box right here, when it first comes in, it's going to be the HIPS code. Well, most of the clients I work with don't get the HIP information from the hospital. So each user can click this column. Now, the way it looked, everybody, and I'll put it back to exactly the way it was before I fix it, is it actually looks like that when you first get it. Is you get this HIPS column and you're like, hey, I'm never going to use that. Well, as each user uses their system, I can delete that out and say, hey, as a referral process, I don't use HIPS, but I really want to see the pay types of my referrals, right? Then I can drag and drop that. And then now I've updated my own lead dashboard. Again, this is mine. If David wanted to see something one way, he can configure his. Heather, Crystal, you all can do your own. That's what I like about this. This one is user driven. But knowing my referral name, where they're at in the cycle, their pay type, ideal for quick reference, right, everybody? And then if I'm going to a meeting, notice there is an export button up here that says, okay, what would you like to print? Well, I'm going to grab everything because I don't know what's installed in all these residents just yet. I can do it as CSV or Excel. This is just a quicker, easier way to look at. And then I'm going to be able to see all the information if I'm going to a regional meeting or maybe a meeting at a hospital. I have some documentation that shows me where each of my referrals and the data that's been entered so far. Okay. Now, during configuration, we talked about our accounts and linking employees that work there. Up here, they're called accounts. In the main database, and when you first, all your communities will send the consultant their external facility list. And in the facility listing, out under financial management, they are referred to as an external facility. Now, the nice thing is these can be driven only to show for certain locations. So if, again, you're multi-state, this may not be at all locations, but in CRM, they're referred to as an account. And I want to link my accounts and the person that works there together. So, I get most of my referrals from area hospital or New York Presbyterian. So if I click on New York Presbyterian, I can see that there are already 2 people that work there, and they're both social workers. But I find out, hey, they have a new discharge planner. I've been communicating with them, or I just got my first referral. First thing I always do is search. If I search for residents, I search for contacts, I search for these professional contacts. I search before I create new. So right now I know there's a person that has the last name of Parks, but there's nobody in my database that matches that as a contact type, professional contact type, I should say. So I'm going to create new. And her name is Linda. She just started. I just started getting some information from her. I can add in any of her phone numbers. I know her email address. I can enter that in. Anything about the city, state. Again, gonna teach you a little trick here, everybody. Now this did say New York Presbyterian, but I don't know zip codes around New York. But I live in Pennsylvania, and I told you I worked in Pittsburgh. Ever you go to enter an address in, you see the zip code box, look and enter the number first. Because in CRM, I can do a lookup and say, okay, this is in Pittsburgh. Notice it fills in your city, state, and country. Accounts, you can do that at the facility level. That doesn't have to be just done at the EMC. That was the configuration. Account updates can be done at the facility level for CRM. And then, as I stated, Linda is a brand new discharge planner. And hit save. So I'm building an internal listing of not only the referral source, the hospital, skilled nursing home, assisted living, but I'm also creating the contact that I'm working with. And that's important because when I go to leads, now you can see I have 2 current open leads. One is brand new, one I've contacted, and I can see when they were first entered. Now we're going to come back and work with these 2 later. But what is the most important thing that we're going to do today is, hey, I've got my first referral now that I'm using, or when you go into a training database to practice. I want to enter a new lead. So I click the new button. I get the option of entering a contact only, or am I getting the actual resident name? So on the rare occasion working in Pittsburgh, I would get, maybe a family member call. Didn't want to give me mom or dad's name, but I could track the contact. But predominantly I got referrals. So either one you enter, you can do. But when I add, think about it just like we talked about the contact at that hospital or skilled nursing location. I am going to search first. So if I search for just the name Jackson, that's my new referral. I hit search. It's going to say, hey, Rick, you had a Steven Jackson in here. Is that the person that you want to work on? Nope, it's not Steven. But if this was the same referral, notice right now, create new resident is enabled. But if this was my referral, notice create new went away, and I can add the resident so it doesn't technically duplicate the person. But again, I'm going to take that check, the radio button out, because that's not my person that I want. So I'm going to go back to the add resident, and we're going to do Jackson, but this one is Fred. Now I'm going to be a little bit more specific on this search criteria so I don't get that person. I can search by last name, first name, social security. Now, if I search and change the radio button, notice the surname field goes away and I lose my search. So I can only search by one item at a time. No, turn my cap lock on. I'm going to say Fred Jackson, and I want to get that capitalized. And search. So now that I don't see that resident, I'm going to say, okay, that's the person I'm looking for. Nobody has them. And the nice thing, everybody, you're a multi-community database. This is going to search all of your entire organization to see if that person has ever been in the CRM for other locations. Create new. Notice anything required has the red asterisk. So I think it was Heather pinging, asking me during the chat box, if I don't have something that's mandatory, is it going to save this? Absolutely not. Because if I said I needed to, date of birth was mandatory, if I don't really have it, I now just got to make something up and then remember to come back and change it if it was a mandatory field and I didn't have it. So that's why I say always be careful with making things mandatory, because 90% may get these, but it's the rare 5% that they're like, nope, we're not far enough along. I'm not going to give you that type of information until we get further on. So be cautious starting off with what is required. Again, I can put, and I'll have access to put everything in here that I need, because the things are just here. They're just not required. But I can fill in as much information as I know. Race, ethnicity, religion. Again, right now, I may not have a lot of information or may not have any. So again, if I don't have it all, I can come back and edit it later. Not a big deal. But if I have the residents' phone numbers, I can enter it. And again, I'm entering this to make the entry easier later. Because again, if I win this referral, all this good data that I'm putting in is going to follow them down. Again, I love the zip code feature, everybody. It saves me data entry time. And you're going to see it again on Monday's call for registration. Use that, because anything I can do to save you a few seconds, that adds up over the lifetime of data entry, everybody. Then, do I want to mark this person as high risk? I don't want to merge this with another record. Now, be careful. If the person does have a Medicare beneficiary ID, that would go in here, not the old Medicare number. That's for the old HIC number, but Point-Click-Care has been around long enough that, since early 2000s, they were there with the HIC field, so they've disabled that, but here it still shows. Always make sure MBI goes into the MBI field. At this point, I'm going to say that, hey, this guy's kind of new. I haven't got that info just yet. I can come update this information later. Now, the resident information is in, and if I ever need to come back and make changes, I can go back into the edit demographics, everyone. Now we come into the lead information. Notice I'm the one putting the referral in, so it's assigned to myself. If I'm a sales manager or a sales administrator, I can give it to another employee. But if I'm only a sales representative, I will only be able to assign it to myself. Those are those security levels we talked about on Monday. This is the one that I think everybody personally should make required, because I see a lot of people leave that blank, and then that lead listing on your main page is blank. You don't know if they're contacted new. So I always say it's best to make them pick the status. And I can put in the lead date. Where are they looking at going? Now remember, if I have a skilled nursing and assisted living, they could be working on the same referral. So I can have more than one possible placement, and you're going to see that here in a second. We're going to say, starting off, hey, I got it. I'm the admission director at the skilled nursing location. They're coming to me first, and I'm working on it. Do I know their current location? Do I know their hospital admission date, expected move-in? In, not required fields. Lead rating, hot, cold, warm. Well, I've only got a little bit of information right now, so I'm going to kind of say warm. I got enough that it's just not like a cold call. Potential revenue, if you do cost outs, you can put information in there. There is a dashboard panel that I'm going to show you later that will track that. But right now, my companies didn't do potential revenue any longer, so I'm going to leave that blank. Notice I said I always knew the payer type. Even though they didn't give me the Medicare number because it's brand new, I know by talking to the person at the hospital, this person has Medicare, and if they come to me, they're coming in under their Medicare Part A policy. So I'm going to pick my pay type. Again, if I don't know this upon every referral, don't make it mandatory. Because this is the case, Heather. If I leave this and try to hit save, I cannot save this entry until I put something in here, everyone. That's why you don't make everything mandatory. Who was this referred by? This is the part that I like. I got this from my account, which is my external facilities, right, everybody? And remember my New York Presbyterian Hospital? Now, look who shows up. Oh, I'm working with Linda Parks. So I'm giving credit not only to the location, but the person. How did they hear about you? Remember the source type, everybody, under configuration? Here they are. So remember the billboards I added in? But this is truly being, hey, the hospital rep said, hey, this place is really good. They do well with our referrals. Contact them, right? Care level. What do we think they're coming in? Now, could that change? Absolutely. And I can come back here and edit any of these. I'm going to say this person's coming in for short-term care. They need a little bit of rehab. They're going back home. Because here's your primary conditions. And I'm going to just type in a fracture and say that he had an ankle fracture. Needs to come for a little PT and back home within a few weeks. But if that isn't part of my dropdown, I can manually type something in here and then have that new referral condition added. Okay, everyone? So that's a nice thing, that if I can't find it here, I can still get it in, but then just have somebody add it to that primary condition. I can put in secondary, other information, if Fred has a preferred name, and then I can put up to 32,000 characters of notes in here. So you can be quite verbose. They will be viewable in here, but it's always helpful when we're doing our admission meeting each morning. Let's look at our referrals. What's going on? Activities. Now, remember I said about not making an activity mandatory? Well, if I don't know what I want to do with this referral, I can technically skip this activity right now. But if I made this mandatory, this would have opened up and there would have been a red asterisk that says, okay, you need to say if you're doing a call, an email, so on and so forth. So that's why I say not doing mandatory activities, doesn't hurt, because I can still put it in. Oh, I'm going to email Linda or I'm going to call Linda. So, I know I got the referral, didn't get as much information as I need. Need more info from Linda. So I'm going to call her at 4 o'clock today. Now you're going to notice Linda isn't available, but I'm going to show you how to fix that because we haven't saved it yet. So I only see the resident. So I'm going to pick Fred just because I'm linking it to the resident, but I'm going to change it to Linda here in the future. And then in our system out in the main database, we have what are called user-defined fields. That is going to give you the ability to track certain information that maybe you never had the ability to do in point-click care. There's still not an option to do it. Each of those can be made available to show over here, and I'll show you that after we save this entry. But I've already configured mine to show 3 pieces of information. Yours will come with nothing connected here. Mine, I had 3 things set up. I'm going to show you exactly how I did this. Does this person use a walker? Well, from reading the material I got from Linda, no, they don't. Do they use a wheelchair? Looking at the documentation, yes. But I don't know if they're a veteran yet. So I'm going to delete that one and hit save. And once I save it, now I get all the other items activated on the right. So notice when I linked the hospital and Linda who works there, now they're part of my professional contact. I only have Fred in. So he's my main resident contact. Let me show you how to build a little bit more of that. But for the larger organizations, these user-defined fields, clients love them because certain parts of the system, there's no way to put things in. So within point-click care, under standards, financial management, your configuration team has a link called user-defined fields. Right now, you'll notice there's very limited items that are here. But again, I can make any of these, if I have the security, applicable to CRM, or I can create a brand new one. Now, one of the things that in my area when I worked in Pittsburgh is we had a lot of residents that were a registered voter. So we had to go out and either get absentee ballots, or because of where a lot of my residents lived, we could use our facility van to take them to the polling place At least the activities and clinical staff did. I was financial. I wasn't allowed to do that, everybody. But I can make it to where somebody can put a date in for something, a money amount, a number. I like this, and I'm going to teach you what the pick list does. I can create text. I can create custom. If I pick text, I can say how long information goes in. I always like the pick list, everybody, because I can take the time to build something and it saves people time in the future. Very importantly, do I want this to show in the CRM module? Again, I can drive this for only a specific facility, corporate wide, completely up to you. I'm going to make this corporate wide and hit save. Oh, forgot my order. Sorry about that, everybody. Again, 1 through 5 puts it in the order in a drop-down menu. 5 will be middle, 10 will be low. I'm going to go ahead and hit save. 1 will be higher. Now notice, because I put registered voter, yes, I really should have put a question mark here, like they're doing with everything else. So let me update that so I'm consistent. Notice, because I hit a pick list, it has a little add item. Dates, characters don't have that. Because now I'm going to build my actual drop-down list for everyone to use. Make sure that's stuck because I didn't hit save the last time. Okay. So now that I created this, and again, many of you may not do that, but you got the flexibility, and this is where we get those wheels turning and discussions happening, right, everyone? Now, if I go back to CRM, now Mr. Fred's up. I can click on his link, get right back over to his account. Now, if I go back into edit lead information, just that fast, I can actually create something. Because again, if I know it now and I win this referral, it will follow them down and update their resident record for you. And that's what you want to do, is get as much of that information flowing when I win that referral, right, everyone? Okay. Want to do a high-level review on some of these tabs? Then we're going to pause the video, take a break, come back, and continue with the lead entry. But remember the hospital, New York Presbyterian? They are located under my account tab. My activities. It's got the tracking phone call that I got to do later this afternoon. I'm going to show you how you can enter activities here, or everybody remember that activity calendar? I can enter it either way, which I think is a nice flexibility. Lead history, not going to see a lot of information at this point because I haven't closed a lead, brought them back, because, again, I got referrals that thought they were coming, was able to go home or went to another location, came back to me 6 months or a year later. So I would be able to see lead history. Possible placements, everybody. That's that important step process you keep hearing me talk about. Putting on a possible placement, wait listing at the location. And again, for my communities that were in Pittsburgh, each location that's working on this referral can put them on a possible placement. And then we'll talk about that, and I'll show you the exact process. And then the last decision maker is the one that, if nobody's bringing them in, the last location makes the decision to close. Documents, this is where I'm going to be able to upload certain size files, everybody. But remember, I activated Doc Manager during my config. If I didn't activate that, this tab wouldn't be there, only this. This is where I can upload documentation that I can share with the admission team that's reviewing this referral. I can have it follow the resident down in from those online documentation storage categories. We will go in and talk about the insurance entry. And again, we'll talk about the eligibility verification that you all have, but is not active in my system. So I have a couple screenshots you heard me talk about earlier. If that insurance company participates with Dorado/Waystar, I'm going to be able to see that in the referral itself. And then under those assessments, everybody, remember those 4 assessments we saw when we come back from our break? We'll start the Medicare secondary payer, everyone, but we just won't do the whole process because it is quite lengthy. But if I complete an assessment here and I win that referral, guess what's following that referral into my system? Everything that I did there. Okay. We're going to come back and hit that in a little bit, everyone. But I also want to talk about this button over to the left, which is called Point Click Care Connect. Now, this can be self-enabled. It used to be called Care Quality, but what it gives you the ability to do is Point Click Care is part of a national network allowing an exchange of healthcare information between care providers for the purpose of the coordination of care. So if you have a hospital that is part of our Connect, you would be able to see that data, but it's in self-enablement that has to be done. Okay. But it's self-enabled. It's really nice because I can see it here. I can see it at the resident level inside the database as well if we turn that on. But again, each client does that, on their own choice. If you're interested in that, just go out to the help section and type in Point Click Care Connect. It'll show you all the steps for self-enablement. But again, could I guarantee that every single one of your hospitals or providers participate? No, but you can always have the option of checking. So it is a really cool feature. It doesn't come, always activated because each client does it themselves. Okay. So before we get into activity entry, adding more contacts, I just wanted to get to getting that new lead in. Again, we're just a little bit past halfway. See if there's any questions, and you could type those in your comments. Y'all been pretty good with this so far. But like I said, some of the questions that were coming in, you're going to kind of see that now that we're starting to get that data entry in, right, everyone? So I'm going to bring us back to the Zoom session. I don't see any chat questions coming in just yet. So I know on Monday, we took a 10-minute break. Is everybody still good with that 10 minutes?
Yes.
Okay. I'm going to go ahead and share my screen again. And I do see the screen sharing and a little red dot up there that it is being recorded. So again, we're picking up where we left off. We got the referral in, only knew a little bit about the hospital contact and Fred himself. But now, remember, I had that activity that I was going to call Linda later this afternoon. Now, I can update that through the resident referral and under this activities tab. But I want to show you another little feature that comes in handy, especially with the amount of referrals that I know my clients receive. If I go to this activity calendar, as we talked about this earlier, as I'm using this, this is populating with all of the activities for all of my referrals that I have scheduled. And you'll see them in different colors. So notice I had a phone call earlier with another contact for a different referral, and it's been marked as completed. But notice on this one, it's scheduled. And if I hover over it, notice it actually tells you who the referral is that this is in reference to. But even better, when I click on it, I can edit it directly from here. So I don't have to go down to my referral. I can edit right from here on multiple referrals that I'm working at throughout my call process. So what I'm going to do is, remember the sub-activity types, everybody, that we were creating, or maybe your corporate team would create for you, is I'm going to call this a follow-up because I needed some information. Excuse me. But remember earlier, it could only see Fred because we hadn't saved the entry yet. Well, now if I delete Fred's name and click back in here, notice I start getting everybody associated to my referral. So now I'm going to say I spoke to Linda. I'm going to just type in a note. Fred has a daughter who needs to speak. So I'm going to mark that as completed. Now, the results, these are hard-coded. You don't have to put this in here, but if I was calling somebody, they didn't answer, I could schedule another call. But because Linda told me Fred has a daughter, she gave me her name, and I'll just say, Sarah Johnson. Immediately, I can create a follow-up activity to call Sarah. Notice I've completed one. I can call, set whatever new item I want to do. If I set my next activity, it's going to now let me do the next entry immediately. And then, first call to Sarah. Now this one, again, we're just playing with dates and everybody. I'm going to call her immediately. Okay, again, she's not in here yet. So I'm going to link it back to Fred for a second and just say scheduled and hit save. So now notice my first phone call to Linda about Fred is now completed, but my next phone call to Miss Sarah is now activated. So what I want to do this time is go back to my leads, go back over to Fred. Now I just found out a little bit more about contacts. I may not know everything about Sarah, but I at least know her name. So again, I want to search. Do I have anybody in here with the last name Johnson? Right now, I do not. So again, I'm creating a searchable database for resident contacts. Now, right now, I may have been given her phone number from Linda, and maybe it was her mobile phone. But that's all I really know at this time. That's fine. Just going to hit save. At least I have it recorded. Now, I know she's my primary contact. Linda stated that on the phone call. Sarah makes the decision, Fred's not capable. And then I can attach what their relationship is. Now, right now, I don't know if she's an emergency first contact. Maybe Linda did say, hey, she is the next of kin, but she also has POA Financial. So I at least got that much information. Those are our contact types. And hit save. So now I've added in a second contact, and notice it is marked as primary with the star. Notice everything I was doing on my activity calendar feeds over here. So now, if I edit this, I'm on the phone with Sarah. Sarah gives me some more information. Well, at the same time, I can now link it by deleting Fred because I didn't have Sarah's information at the time. I can now link it back over to Sarah. Sarah would like a tour on 4/5. Mark is completed. Again, still doesn't meet these things. The result, if she didn't answer, I could put that. But I'm going to create a follow-up activity. This time, I'm changing it to a tour. Now, the system only lets you pick half an hour increments, so you can't say 2:15. You have to pick 2:30. But again, who's coming to tour? Sarah is. And I have it as scheduled. So notice I'm taking credit for everything that I do. Now, I'm just working through my referral, but Tiffany, you work at my sister location. You're working that same referral, so you might be putting your own notes in here, right? Because you got the same referral. So I'm going to continue updating this for everything that I have. And again, I'm going to see my notes. Tiffany would see hers. But Sarah sends me over via email a copy of his insurance card. Great. I can go into miscellaneous. I can click new, put in the date that I received the information. Pick any category. Again, I don't have one specifically for insurance cards. So I'm going to put it under that test category 2 that we created, but just think that would be my insurance cards. Notice it shows you exactly where that card is going to be viewable. Point click care does accept a lot of different file types, but if you download it into a file type that we do not accept, it won't come in, and it cannot be larger than 5 meg in size. In your main database that you're going to learn on registration day, you can upload something that is up to 15 meg in size in the main resident database. CRM only allows for 1/3 that size. Now I'm going to hit choose file. Now you can't see this, everybody, but it's on a different screen. I'm going out and I'm going to grab one of the checklists for today that you have available out there on your information for your OneDrive. And it's actually, believe it or not, the lead entry that we're talking about today. And hit save. So now those that have access to CRM and can view this area can hit actions and view what I just uploaded. Nice thing is, if I win this referral, it is going to follow that resident down into the database with them. Now, with the insurance card, once your eligibility verification has been turned on, and I'm going to, again, I have screenshots to show you this part because we can't activate it in a training database. But now I know that, hey, this person has Medicare. Okay. So I'm going to search through and notice it pulls all the insurance companies from your main database. And I'm just going to look for the one that is Medicare. Now, when your EV is turned on, you're going to get a list of buildings that you can run this through depending on your security. Because if you're a single user, it'll only be yours. If you're a regional person, you may see multiple locations. But it'll also talk about an NPI, and that's how it runs the verification. And all I do is put in their Medicare number, rank it as primary, secondary, tertiary, and hit save. Now, in real life, when your EV is turned on, you're going to be able to view the verification. But like I said, I don't have that functionality in a training database. So we actually make these available to review for you. So when the eligibility verification is run, you're going to see a series of different color banner bars, green, orange, and red. Green, we're going to see over here, they're active. Everything's looking good. And depending upon what they want to send me, because remember, each insurance company sends over what they want, not everything that we may need. So I still may have to reach out to them. But orange banner bars means that, hey, there's some information in here that we really want you to notice. Could be a Medicare Advantage plan is active, Medicare secondary payer, a home health care, hospice. So it'll actually alert you to those. And then I will be able to review that information. And you'll notice none of this is real, but I'll be able to see that benefit information. Do they have Part A, Part B? Is there any termination coverage? And when you start seeing it in your live database, for those that do financial, you're going to love it because it does an instantaneous verification. And as long as I don't put an ineffective through date in the live database, it'll run it every 7 days for you on a set schedule. But if there is anything related to home health care and hospice, I'm going to see that information here. Is there a start and end date? The thing with Medicare is the date that it runs is 16 months. It runs 1 year backwards and 4 months into the future. So I might get a notice on here, but the person's home health care benefit period ended, but it ran it over the period that it ended. So again, you're getting a big look at their verification, but you want to make sure everything's okay. And again, as we all know, it's only as accurate as other providers bill. This is just an example of a United Healthcare response, okay? Again, United Healthcare could give more information or less information than a Blue Cross or Cigna. So each of the insurance companies are going to vary on what type of response information you get. And you can see United Healthcare is very, very detailed, everyone. We're going to get into those. And when you see them in your live database, again, not every insurance company participates, but you'll know that because it'll say that an NPI cannot be run because it's not linked. And that just means, hey, that insurance company doesn't provide verifications through this process. We're going to have to reach out via phone call or if I have access to a website. But if you're able to run EV, I'm going to be able to view those directly through this tab, knowing they have it upon referral. Then under your assessments, again, we talked about the 4 that are preloaded into my database. I'm just going to start off using the Medicare secondary payer questionnaire, everyone. Not going to do the whole thing because it just takes a little bit of time to answer all the questions. But if I complete an assessment here, it's going to become part of this record. If I win that referral, it is following that person down with them. So again, I'm going to edit. And Point Click Care has built basically the same Medicare secondary payer questionnaire that everyone uses. This is just an electronic version of it. You know, are you receiving Black Lung? Nah. Are you receiving benefit research grants? No, I'm not. Has the Veterans Affairs authorized? No. Is this work related? No. So again, I can skip those things and go to save and next. And I'm only going to do the second page, everybody, but I think you get the gist of the electronic version of it. Was this illness due to a non-related work injury or accident? No. It's caused by an illness or injury? Nope. So I would just continue to complete this. Now I'm just going to save and exit because I don't want to take up enough time going through all of these different pages. But this becomes part of the record. And if I hit back, once it's completed, it'll be saved, signed, and locked. You can see this is still showing as in progress. I can always come back here and, continue. Here I can close, delete, or print, or I can click the description, which will put me back into, maybe I didn't have time today to complete the whole MSP questionnaire because I didn't know some of the answers. But again, it can be part of the referral process. And then it becomes part of that when I show you the possible placement and waitlisting. Okay. Heather, were you talking about the full MSP? Yeah, as you clearly saw, I can fill out a couple fields, save and exit, and then I can come back in and complete anything else I want at a later time. It'll basically highlight where you left off. Okay. So if I don't have time to finish it all, I can come back later. Not a big deal. It allows me to continue till it's completed and saved and locked. Now, so let's say Tiffany gets the same referral and she comes out in the CRM and she does the search. Nah, you can't make it mandatory because each person can either go in here and make that. You can make it mandatory as an organization that they have to use the assessment, but the system's not going to make somebody, come in here and click new. You can teach the staff that they have to complete the MSP questionnaire on the referrals or at the community resident level. Okay. So let's say I got the referral, I data entered it. Tiffany, who works at my sister community just down a few miles away, comes in the CRM and she sees the same referral. Okay. Okay. Tiffany, I just answered that same question. It can't be entered as a workflow. You can teach the staff if your organization wants to, but there's no way of forcing them to say they got to do that. You can't teach, CRM can't force them to pick the assessment, everyone. You can teach them that they have to do it, but that's an internal process that you can teach them. But let's say Tiffany and I are both working on this referral. How am I going to know that? Well, Tiffany's going to be putting her notes in there. But as I continue to work down through this, again, we're going to say that we advance a few days into the future. Problem is I scheduled 2 tours at the same time. So hopefully I have a coworker that's going to take care of my other tour because I'm going to be working with Sarah. And we're going to say that Sarah came and toured. She liked it, but she has a schedule with Tiffany as well. So we're going to complete this one. Now I don't want to do a follow-up note just because I'm not sure where this is going to go. But thinking that we might win the referral, and she said, hey, yeah, I want you to kind of think Fred's coming, but I'm not 100% sure until we talk to Tiffany. So I'm going to go back into Fred's account. And I'm going to go back over to possible placement. So a couple people ask, how would I know if me and another location are working on this? One is when you get to the possible placements, because if I have it automatically turned on, it will do an automatic placement for your location. But right now, let's say that I work at the Nursing Advantage. So I come in here, I put them on a possible placement. I can select a room, everybody. It's not a requirement, and it doesn't follow them down during the quick ADT process. And I'll click 1009 just to show you and hit add possible placement. Now, at the same time, Tiffany's working on this. Now, I'm logged in as Tiffany, everybody. She works at the clinical standard database, her location. And she's not sure what room, but she still wants to put them on a possible placement because we think they're coming. Great. I can just do check mark my location, add possible placement. Now I can see both locations. And a lot of people have been asking, okay, well, if I elect not to bring the person, I will not have this lead closed, because notice if I try to close this lead, it shows both locations. So like I said, a lot of the questions y'all had were great. It just never got me a chance to get to this point, but now you're seeing why we don't close the lead until the final location makes that determination, right, everyone? Because if I close this lead, notice it's going to close it for both locations, and that's not what I want to do. If I elect to not pursue this lead anymore, she goes to visit Tiffany, she likes Tiffany more than Rick. Okay, I can delete my possible placement. And that's what you want to do, everybody. If you're not going to pursue that person and you've put them on a possible placement, just delete it. Then it's now only for Tiffany to continue following up on. And again, if she elects not to bring that person in, notice when she goes to close it, it is now only linked to her location. So all those additional questions, that's how you want to do it. Okay. Now, we're going to act as if Tiffany wants to bring this resident in. They toured at Tiffany's building. They loved it. They notified me, hey, Rick, we're not going to come. Hey, not a problem. I know Tiffany and her community. They're great. Enjoy it. But I got to remember to do action wait list at facility, because if I forget this step, and I want to show you how you would know. If I go down to Tiffany's database, sorry that I'm picking on you, Tiffany, and I go to admin and residents, or maybe it's your clinical, person's coming in on a weekend, and they go to the resident list, there is a tab called a waiting list. Notice I don't see Mr. Johnson there, do I, everybody? Because now I can do this at the facility level. I don't have to keep jumping back to management console. I can go back to my leads. And the nice thing about this dashboard is, notice there is a waitlisted column. And I don't recommend you take that off. Because if I know if Fred is coming later, I want to make sure that says a yes. So if I go back to Fred, I go back to his possible placement, waitlist at facility, and maybe he's coming in on Friday in waitlist. Excuse me, everybody. So now we advance to Friday. Tiffany's waiting for Fred to come. Something held up. He doesn't come there when Tiffany's there, but he comes in, and my clinical staff needs to get the resident into the database so they can start documenting. Again, I can do it if I have the security rights from either side. So you'll notice admin if you have proper security for quick ADT, or in my scenario that I'm kind of walking you through is Fred finally comes, but it's late in the evening. My admission staff has gone home. Clinical will need to check the waiting list. And now that I did that, look who showed up. They are going to do the ADT. So ADT stands for admission, discharge, and transfer. They are going to pick, is this his first admission or maybe was he readmitted? We'll talk more about your census activity codes later, everybody, but first time referral, actual admission. When did they come in? Now, we said 4-5, but I'm going to make it 4-5, just not later in the evening. Clinical, what we put in CRM was, hey, he's supposed to be Medicare A. Well, clinical doesn't have to answer this, everybody, because they technically wouldn't know what the true primary payer is. We'll continue that process on the financial side later. Even if I selected the room, it will not auto-populate here. So even like if I accepted it into my building, I would still have to pick the bed that comes out. That's why we say picking the bed is optional, everybody. Doesn't have to be done. You can just say, he's coming to my location, make it active, and that's what gets you here. Because I'm still going to have to pick the bed no matter what at this point, because things change. Where do you come from? This is hot list driven. So when I pick acute care hospitals, I only get the hospitals that are activated in my external facility link. And then if they know anything else, they can put it in. Again, maybe they don't have Social Security. They still have to figure out the allergies, but maybe they know that James Robinson is going to be his primary physician. Hit save. This is just telling you that it's going to update on the financial side because we need it for billing purposes. Save again. You will notice, everybody, the screen does not refresh to populate that physician there, but it has been assigned to everyone. We're going to hit save and new, or sorry, save. So now clinical got them in on what's called a quick ADT so they can start doing their documentation. So if I click the waiting list tab, you'll notice Mr. Johnson's no longer there because now he's a current resident. And, or I'm sorry, Fred Jackson. If I click on Fred's name, I'm going to be able to look at, and I'm going to go over to the admin side, everybody, because I'm a financial trainer. All that information that I've been putting up. And remember how I said, even though it didn't look like the physician came in, it was there. Remember all my user-defined fields? Now, I never completed the assessment, so that's why it didn't come down. But anything that I put in will follow that resident down, so it saves myself additional data entry. But it's important. If I don't do the possible placement and wait list, they're not going to see the resident in there. They're probably going to go and do a new resident search. Well, that resident's not in the database, they're in CRM. Doesn't see that person, so they could end up duplicating the person and manually entering them rather than bringing all of your good detailed data down with it. Any questions over that possible placement and wait list and how important that is? So I showed you what happens if you don't wait list. Doesn't appear in your database, right, everybody? Compared to now seeing them down there and allowing for the quick ADT process to bring all that good data that we've been keeping up in CRM. Now, if I go back to CRM, guess who is no longer there? Because at this point, whoop, can't even spell Jackson on a. Fred has been marked as 1. Like the activity notes? Is that what you're asking, Tiffany? Those don't come down because they're just activity notes in CRM. I'm going to be able to pull reports and you're going to see certain things for those, but activity notes don't follow them down. The contacts, assessments if completed, miscellaneous documentation, demographic information, that follows the person in, not activity notes. But the nice thing is I do not have to come back into CRM and mark the person as 1. It closes the lead and marks it 1 for me. But all my activity status still all there, and I can print all my activity notes that I ever need. Even though they're closed, I still have access to that information. Now, let's say that we're working on another resident, because I showed you the wait list, but we're going to say a little bit later in this conversation, I found out for Deborah Seeger that she wasn't Medicare A. She was a managed care company that I'm out of network for. So I'm going to change her to managed care. I'm also at that same time at least going to mark this over to contacted. Because again, I want everyone to see how this drives my banner bar, but also how it drives this sales cycle so everybody knows where we're at in the process. Okay. Now, in this case for Deborah Seeger, Tiffany didn't get that referral. It was just sent to me. We kind of did our due diligence. We found out they got an insurance company that we can't take. So what else can I do? I have to close the lead. Remember my options between the denied versus lost? This is the reason I ask all my clients to make the status reason mandatory. Because I could have marked that as denied, but if this wasn't required, I wouldn't have the exact reason. And do not. Now the status flips to reopen. So even if, Tiffany and I are battling for the same referral again, I can't take them, she can't take them. Whoever is the last one to make that decision can close the lead for whatever reason. But we don't close a lead in a multi-facility organization until the final location has made that determination, because it will close it for everybody. Excuse me. Okay. Now, before we move over to testing or looking at the dashboards and reports, because is of the utmost importance. And I know most won't unmute their phone, and that's fine, but anybody that's communicated with me real quick, if this person was going to come to me, Steven Jackson, can somebody tell me where I go to put that person on that possible placement and do the wait list? Because I kind of reiterate that because I think you've all seen how important that process is, right? Is there anyone that would be kind enough to unmute to walk me through those just 2 steps to make sure everybody's comfortable with it? No? Okay. I'll walk you through the steps then if nobody wants to. Oh, sorry. Go ahead.
We're gonna see if we're like we are right.
Daryl, good job.
Good job.
Okay. So Daryl, you say go to actions. What do you mean by actions?
Hit the person.
Oh, thank you, Crystal. That's right. Well, remember, the first thing I got to do is get to the possible placement first. So you actually did the second step where I needed them both done, Daryl. You were actually one step ahead. That's all. But absolutely go to the possible placements first. So Daryl and Crystal kind of tag teamed and got that one correct. I would search where I want to put. Now, if I'm a regional, I have access to multiple databases. I can waitlist it more, I can do things at more than one. We're going to just do the possible placement at only the single location this time, everybody. But as Daryl stated, very important. I did the placement, but I got to remember that actions and waitlist at facility. Thanks, everybody. Absolutely. Okay. So that's the process. And like I said, I teach it in as much detail as possible because the final part of this session, excuse me, is going to refer to those dashboards and reports. Yes, if one of them brings that person in, again, it's going to close out the other possible placements because remember, it marks it as one and closes the lead for you, right? Tiffany asked the question, if multiple facilities are listed under possible placements, will those automatically be closed? Yes, because of the sheer fact that once this account closes, these all close with it. Same thing, if you think about it, Tiffany, kind of a different way of, your question. If somebody closes my lead, not looking where we just did, they could close my lead even though I didn't want them to. And remember how it was going to close both of them at the bottom before I decided not to do so? I have removed the possible placement. It could close it that way too. So that's why when we're closing leads or looking at possible placements, always check. Again, big corporations, multiple clients could be working on these. So now, the dashboard that you keep hearing me talk about is this dashboard here. And it is related to 8 different panels. Some, as I stated, you may not use. And a lot of clients don't use, but this can't be replaced, everybody. It's kind of a hard-coded format for the panel. So if it's something you don't use, it just is going to stay blank here, everyone. But I have the ability to see and set different parameters. Now, at the community level, I cannot change this on how others are going to see it. Management console, I can. All I can do down here is maybe I'm working on this, and again, you'll see things related to your community. If I click that little dot dash icons up in the top right corner, it's going to give me the availability to change these options. So again, being run at management, if you're starting to see things at facilities that maybe are not yours, but it's default set that way, I can come in here and say, well, wait a minute, let's kind of look at just my location and hit search. Now, I can save it, but it's not going to save the per se dashboard view. This is just for me to kind of pare it down to my locations, or I can even do it to the people that are assigned to. All it's going to do is let me view different filter results under those little icons. And I'll point that out again when we get back to the dashboard here. I can change what it's viewing. But, when I worked in Pittsburgh, being a BOM, I was more worried about 30-day look back periods. But a lot of the regional staff that I worked with in admissions like to look at things quarterly, 6 months, 1 year. Well, at the facility level, I can't change what's called the managed dashboard. My corporate team that has access to management console can see the same dashboard, and they'll see it for all of the locations or any of the locations that they have security access to see. But here's the nice thing. At management console, this manage dashboard button works. But what it does, ever I change this to, it's going to change that view for everyone. So notice we've been working in the lead dashboard, and I said if Heather created one, that's her dashboard. This dashboard is organizational driven. Now, I kind of always update things here, everybody, and I use my top sales rep as an example. But it can be any of these. You know, if I wanted to look at my leads by source over a quarter, 6 month, year, I can create as many filter options back here as I want. I can only have one active at a time. So let's say, you know, I already have the top sales rep 90-day, but organization says, hey, we want to do a giveaway. I'm not sure what it could be, everybody, but we want to do it on a year to the top sales rep. So what the top sales rep means is who that referral has been recorded under. Myself, Tiffany, Daryl, Crystal, anybody. Well, in here, I can change this. I can do 12 months, 365 days, whatever you want to set it up to, everybody. Hit search. Now, my database isn't that old yet, everybody, so there's not going to be a lot more data. But imagine a 30-day look back period, which is our system default. I can easily create multiple look back periods. Then I can, and you can see I do this quite often with my clients because it auto-populates my answers. Top sales rep 1 year and hit save. But again, I created a filter, haven't activated it. But the moment I do this, activate the 1 year, hit save, not only does it become active at my EMC, notice everything else is system related, 30-day lookbacks. But I have now driven that look at each database. And I'll only take it to the last skilled nursing home. This dashboard is organizational driven. So it's not based off of the user that created it, like the lead dashboard at the facility level that I was working on earlier. It's kind of nice if I'm getting everybody together for a big regional meeting, right, everyone? I flip these on and off. As soon as we're done with our meeting, guess what? Going back to management console, going back to CRM and dashboards, managing this, putting it back to the system related 30-day, hit save, everybody's back at that normal 30-day look back period. These can be turned on and off just that quick. The other thing you have in here is reports. And remember, reports, user driven. So as you can all clearly see, I did this training this morning and I already created my own. So again, report views are individuals. Everybody can set up what they want. Tiffany wants one, she creates her own. That's hers. Heather, Daryl, Crystal, they create their own look back periods. So You'll notice on the left-hand side, there's 5 categories. Excuse me. When this first comes in, this wouldn't be there, everybody, but I'm going to show you exactly how I did it. I'm going to go back and always start with the system-related system, which is normally, for most reports, 30 days. There are a couple that look back a year, and you're going to see that as we go through the session. But you're going to notice it is looking at the lead date for the last 30 days and where they are in the status. So notice I have some that were won, lost, but it even showed me what happened. I denied them, out of network. Maybe, I only want to see denied. I can click this pie chart, or if you notice over here, I can filter it down as well. This little, I refer to it as my Snoopy doghouse. Click that. I can do the same filter change here and put it back to the original setting. You will notice there is no resident data displayed. Because if I'm doing a presentation with hospitals, anybody else, there's no HIPAA violation whatsoever. But, Jana's like, out of network, who was that? Click the 20 or their name, number. It will then take you over to that person's referral account so you can actually see who it was. But it will not show you any of that data ever on these reports. You'll never get a resident name to display here. If I'm doing presentations, I can print my pie chart. If I want to export the data, all it's going to do is print you an Excel or CSV file of those tables. But I'll be able to print charts and export. Print charts, not on every report, not all of them use pie charts. Exporting data I can do on anything. Now, where you saw me change that other report was under this little pencil icon. So maybe I wanted a 6-month, right? 180 days. Apply the filter. Now, in real life, I'd get more look back. I can say save as 180 days. Now, when I go back, I got a 30-day, a 90-day, 180. I don't have to keep changing filters. But again, these are my reports. Nobody else can see them or use them. Tour conversion. This one's a little bit more detailed. Notice it's going to look back one whole year, but I have to have an activity of a tour, and that tour must be completed. So I can add additional filters into these as well. This one's nice because I've never had one client say, hey, Rick, I need to go back more than 365 days. But if you did, click your pencil icon, run it down through. Now, for those that might be a regional person, and maybe I want to set this up to look at a specific set of homes and not the entire organization if I have access to them all. When you start getting into adding filters, I can say, oh, okay, maybe I want to do this by facility. Select the word in. Now I can pick a single facility, or, like me, I had 13 buildings under me. I could have checkmarked those 13 buildings, gave it a title of, tour conversion, Pittsburgh region. Save it. Now I don't have to come in here and filter set this each time. Now I can if I wanted to. But for regional people, setting them by only your facility, if you are given full access, very nice feature. Because, I've had some executives They're like, hey, Rick, I got access to everything, but I want to break it down by my regions. Is that possible? Absolutely. Just by doing those filters, but then give it nice, good names there as well. So you know region, east versus west versus south, or however you call your regions. But I can customize my reports, but again, they're mine. Referrals, you get 4 options, everybody. Referral analysis by account. This is just going to show you, remember what we call an account, everybody? Those external facilities. How many am I getting from the area hospital? How many am I getting from New York? Now notice that nice, easy little pencil icon is not where it's normally at. If I click the display option and expand that, notice if I needed to create a longer look back period, everybody, now I got to expand it to find my pencil. And I can do the same thing like I did on the first series of reports. I'm not going to keep, saving those, but if it doesn't always display like you saw on those first set of reports over here, look back at that plus, and you'll find your pencil icon hidden back there. Referral analysis by facility. Now that I started, admitting and denying through multiple locations, again, as a regional or executive for the company, I'm going to get a way to view each location separately on a quick reference. But again, 30 days. And I got to expand it if I want to set it to be older. Referral by account. I like this because we're back to my pie charts. I don't know, I like pie charts for some reason, everybody. But just like before, oh, well, maybe I'm going to be doing a presentation with New York Presbyterian. Okay, let me activate them, click my chart, get my paperwork together, do my presentation with them. Oh, I'm working on area hospital tomorrow. Let me get my stuff prepared for them. So it's kind of nice. Like I said, a lot of this I used to do with my admission departments, and we did a lot of things on Excel files that this system is actually able to do for me. Notice my filter icon, everybody, back over here to the typical left position. So I don't have to expand it and find it. Referral status by account. So this takes it a little bit deeper. Is notice, still looking back 30 days, still through the same areas. Notice I have the status reason and a competitor link. So if I'm getting a lot of referrals from New York Presby and I'm denying them or losing them, this is going to show it. And, if I lost to a competitor, why? So this one just went a little bit deeper based off of the additional filter that was done. That's all. Sales, lead status by owner. Think about that as my top sales rep, right? Everybody that we saw on the dashboard. Again, if I'm a regional person, I can be watching all of my locations and seeing the referrals that are being done through all of them. But again, same 30-day look back, but it's given me information. What am I winning? What was lost? Notice I got a lost. Oh, wait a minute. Lost somebody to Presby. What's going on there? That doesn't happen all the time. There's my denied for out of network. Again, same filter options here to reset if we're just having a meeting and driving down to specifics. Lead by sell cycle. Again, right now, the status of this account has to be opened. I've closed a lot of accounts and won them and closed them. So that's why I'm not seeing a lot of data here, because I only have one more that's currently open. And that's what it's talking about. The status has to be open. Where are they at in the contact flow process? This is a report that I like but if I can't get my competitors in and I don't link the competitor, this report won't give you the data that you hope for. Now, again, 30 days, probably not optimal, but this one I probably wouldn't save, but we always had spreadsheets that if we lost somebody to a competitor, if we could find out, we were able to track it. This report, I could set back, not save it, but have it go back and look, did we lose somebody to a competitor? And are we seeing the same competitor over and over? Is it a geographical reason? Things like that. So that report is good. But if that competitor name never gets entered, you can see lost a competitor, but if you don't put the name in, you just wouldn't know who it is. We're not going to save that because I didn't want to save any of these. Marketing, leads by source. Remember how'd they hear about me, everybody? This, I think, is a great report because now I know where they're hearing. Hospital rep, social media. Hey, I had an employee referral. Great. But again, 30 days. I can set that back just like we've been doing. Print, export, like you said, it's always there. Your trending reports. I've not met anyone that has updated these because they are a 12-month look back. Monthly leads by account is just going to show me the referrals that are there, right? Pittsburgh, we always kind of had I always called it a roller coaster. Summer, it dipped down. The winter and fall, it went back up. Spring, it started this will show how those referrals are going. But again, I have management console access, so you notice how it's grouping all those together. Again, if I'm a regional person and I want to start adding filters to see where that was at. Okay, well, what account was this from? And I can type in that, what was it, New York Presbyterian, add another filter. This one limits you because it's kind of more of an overview type item, but some of them you can drive down into additional things. This one, monthly leads by facility. Again, I'm going to see that broken down as I work more and more through my communities. Now, again, I'm looking at it as a kind of the executive, but if I start adding filters, I can say, okay, well, let me break these out because now I'm getting a cumulative total. I only want to see the nursing advantage home, so I can create one for there. Or again, if I'm running a region, I can select my 2 or 3 locations, apply it, create a default. But again, it's your report. So you can configure that to region-based, facility-based, whatever you like. But they're already looking that full 12 months back. So a lot of people are like, hey, that's great. But yeah, that apply filter to do my region makes sense for, a high-level executive where you might have 3 or 4 regions. Let's break that down instead of seeing all the buildings together. Let me break it down by my regions. So again, everybody, there's flexibility, but they're your reports. Unlike that dashboard, every report that I created was yours. Okay. Last 2 things, everybody. Under your accounts, there's one thing that I show all my clients is sometimes an activity that I do at a hospital may not be really relative to a specific referral. Has anybody ever done a marketing meeting at a hospital or just took somebody lunch? Kind of get together and chat, right? Under your account tab, under area, you'll notice outside of my contacts, it's keeping track of the leads that I get from them. notice there's an activity tab. Well, if I'm just doing a marketing meeting to them, I can enter that in as a meeting or phone call. It's not really relative to a specific lead. It's just something I did with that location. You can enter that directly into the activities here as well. It does not have to be just related to a specific resident. And I know my admission team did a lot of marketing meetings at certain hospitals, take them lunch. Again, they tracked it on Excel spreadsheet or handwritten notes. They can be entered directly in there. A&O stands for availability, and occupancy, everyone. This, again, me being a full enterprise user, I get to see all the locations. If you are set up to only have one facility, this would just show your facility. But I can easily see what is happening at my community, which beds are fully occupied, which are fully available. If I'm a regional person, I can switch from one to the other and it updates over there as well. So I kind of can see not only percentage wise, but really what is going on in my real database. If I need somebody to come into 1007, is it available? So very useful there as well. Now, last thing I want to talk about is that little button up in the top right-hand corner. Some people may use this, some people may not use it. It's completely up to each organization. But we offer what is called CRM on the go, which is an app download that you can use. Now, you can't do as much with that app like you can here. So if you're technically a remote user, you take your laptop, you can log into Point Click Care and do what you saw me do in CRM. But I've never had to go any further than clicking the first button, and I hope y'all keep me at 1,000% batting average. Because the only thing this button does is tell you to download an app from the App Store or Google Play. Is there anybody on this call that has never downloaded an app in their life? That's the same answer I get from everybody. Only thing I warn every client I teach, make sure you look for that specific logo with a little P up in that white circle, because that'll tell you it's a Point Click Care application. But if you download it, you're going to be able to log into it. It's a very concise CRM on the go, so you can see a lot of this information. Again, I won't be able to go in and log activities and do a lot of that detailed information. But if your company allows for things to be downloaded to your phone, there is this CRM on the go to kind of see high level information. Okay. Now, just real quick, everyone, I'm going to pop up a quick little poll here. It is only 4 questions. 2 are multiple choice. 2 are true and false. Right now, I did launch that poll. I'll give everyone about 3 minutes. Hopefully 3 minutes should be sufficient. Just kind of a quick overview of some of those items, and it's more relative to that lead entry type items that we were talking about. So if y'all, not everybody, but if a lot of you wouldn't mind participating on answering those questions, I'd appreciate that. Okay, for about 30 seconds from me shutting that poll down, everybody. I got almost about half participation, so thank you very much. Okay, I'm gonna go ahead and I saw one more person answer, so I'm gonna go ahead and end, oh, two more people, end that poll real quick, everybody, and just share some results. So when assigning activities from a lead detail or from an account, where else can I see an overview of the activities? And 73% of you got that correct. It is under that activity calendar icon. Remember, that was kind of where I liked updating because I can jump from one to another, right? Without keep going to different referral leads. Number two, accounts in CRM are called, again, 45% got this one right. They are called the external facilities in the admin or the remainder of the module, everyone. Okay. True or false for number three? Once the resident is entered in CRM as a lead, you will be able to see them in the admin or billing or even clinical side to continue entering additional information. Actually, the 27% got that right. What was the one key term, everybody, that's missing from that question? Remember, when I entered the resident, and even when I put them on a possible placement, they didn't show up in my database until I did what, everybody? Waitlist them, right? So till they're waitlisted, the rest of that system does not see them. And a lot of people kind of, miss that word waitlist isn't there. So, not surprised because we don't see them until they're waitlisted. And then again, number four, true or false, when a lead is placed on the wait list, you will not need to close that lead as one after doing the quick ADT. Again, 73% got that correct because as we saw with my example resident, once I did the quick ADT, it closed them and marked them as one for me back in CRM, right, everyone? Nice. Thanks, everybody, for participating. Okay. I'm going to go ahead, pop it back over to the PowerPoint presentation, everyone. Now, again, please remember there was that link at the top of the chat bar, and I'm going to go ahead and put it down here again at the bottom. Just in case if you have a pop-up blocker turned on, everyone, we are asking, and as I said at the beginning of the call, there is a survey that pops up at the end of each of these. If you could, I'm only going to release it in the chat box the last session each week for you. But if you won't mind just saying, how comfortable you're feeling, like I said, it's only like 3-4 questions, really quick survey. But we are really asking for, your honest opinion of how everything's going. But please remember moving forward, everybody, take credit for what you do in CRM. Enter your referrals, enter your activities. Again, for those that are going to be configuring, work with the team to make sure it's applicable for all the organization. Again, I can create predefined activities if I would like. They could be specific to the AL, IL, and SNF, or even a yet to be determined status. Enter the leads, follow up, document what we're doing, right, everybody? Again, as you saw during the possible placement, the room is not required because even when, I still have to enter it in when we do the quick ADT. But remember, the possible placement is the first good step, but make sure we have them on that wait list. And that's what my dashboards and reports, dashboard gives me that perfect, hey, they're accepted, they're waitlisted, my building can see it, they can quick ADT there. But you saw some of the other, dashboards, the reports you can customize. The main dashboard, the 8 panels, is organizational driven, but the reports can be updated and configured by each individual for filter settings that they like, date ranges that they want to see. And again, if you're using the activities, review those open activities from your calendar or even under the activity tab to easily review what is going on. And again, don't forget about the resource hub, everybody. A great area for some information, as well as, remember I talked about the Guide Me and I showed you that on Monday. CRM is fully functional for the Guide Me. So if you forget an item, oh, how do I do a possible placement? When you're in that referral record, click that Guide Me Interactive. It'll show you a lot of steps, which is really nice. Again, this is some optional items, everybody, in the training database that you may have access to is, enter your referral as your name, because what I would like you to do is use that person throughout the rest of our training sessions. So hopefully not a lot of people have the same name, but put them in, kind of start tracking them if you have time, because it just lets you practice with the system, everyone. Next session, everybody, again, we will be meeting again on Monday afternoon, and we are going to be talking about registration. Got a quick glance at the Point Click Care application when we did the quick ADT, but then we're going to take it even further. What do all those tabs do? What do I want to enter in there? That's what we're going to focus in on, registration. Okay. Excuse me. As you all know, we always end it with our team motto about the tell me and I forget, teach me and I remember, involve me and I learn. But at that point, everyone, I'm going to go ahead, stop sharing, bring it back to the normal Zoom session where we started, and share my video one more time. And thank you all again for taking, I know 3 hours is a lot, taking that time out of your day to see the next part of Point Click Care, which is your CRM module or customer relationship module. Again, if you have any questions, you can email me. If I don't talk to you by the end of business day Friday, have a great rest of your week, even better weekend, and I will talk to hopefully all of you again on Monday afternoon for the next session, okay? Thanks, everybody. Take care.